Chair, I can confirm we're now live.
Thank you very much. Thank you, Kirsty. And welcome everybody to this afternoon's Bracknell Forest Local Outbreak Engagement Board. It's a pleasure to see you all here. And we'll commence this afternoon's meeting, please, with any apologies for absence, please, Kirsty.
Chair, I've received apologies from Charlotte Pavitt and Tessa Linfield, although people do have challenges accessing digital meetings on occasions. So any board members who haven't provided their apologies and who aren't present in the meeting will have their apologies recorded.
Thank you very much. Thank you. Okay. And we have one urgent item of business which we'll take later on in the proceedings, and that is an update on the national guidelines as issued during the Prime Minister's speech yesterday. So that takes us then to agenda item 2 now, which is declarations of interest. Does any member have any declarations of disclosable pecuniary or affected interests to share with us at all? No? Well, then the usual caveat applies, please. If conversation or debate should move into an area where you feel you are conflicted, please don't hesitate to interrupt proceedings to record it. That said, we'll then urgent items I've mentioned, and then we come to agenda item 4, which is the national and local COVID-19 status, and that's being handled today by Sabrina Carr. Hello, Sabrina. Welcome.
I'll just briefly share my screen.
Thank you.
So, fine.
Yep, we have it.
I'm just trying to make it big for everyone to see. There we go. So starting with where we are at the moment, Bracknell currently has a rate of 95.5 per 100,000 cases. This is as of the 22nd of February. And for those over 60, the case rate is 65. So we're seeing a decrease in both of those indicators. There's been 117 cases in the last 7 days. So that's also seen quite a large decrease between the 11th and the 17th of February. Looking at neighbouring local authorities, we can see that the rate across the area is going down. In Bracknell, which is over here, the neighbouring local authorities also have lowering case rates as well. On an electoral ward level, we're again seeing decreases across the authority. However, in College Town, where we do have a military presence, the rates are still slightly higher. However, take caution as these are small numbers, so the rates can be quite wavering. Again, this is a map illustrating the rates seen on the previous slide, at ward level across Bracknell Forest. So similarly, the rates are going down in many areas, and we'll keep an eye on the wards that are a bit higher, such as Crowthorne Ward, as you can see here in the darker blue. Across age groups, so as the 60+ case rate has gone down, you can see here in Bracknell Forest that it only represents 5% of cases. So this is much lower than other local authorities seen across Berkshire. So this is good news. However, this large proportion of 44% seen in the 18 to 34-year-olds is very much attributed to the outbreak at Sandhurst. Looking at hospital activity in Frimley as well as Royal Berkshire, admissions and inpatients are going down. So this is a positive trend. Deaths as well in Bracknell Forest, as we can see that COVID-19 deaths, it's seeing a slight increase in the most recent, but it is starting to go down. Thank you very much.
Thanks very much indeed, Sabrina. Thank you. Are there any questions for Sabrina? No? Okay. Oh, yeah.
Yeah. Yes.
Councillor Dr. Barnard.
Thank you. When I look at the data and it talks about, 4 or 5 cases per ward, is there any way we can break that down into the, in terms of the numbers of cases, are they connected or separate? Because, for example, it springs to mind that 5 cases could be because of one household, and things like that. Because as we move through this, understanding whether it's, widespread across the community or whether it's, linked to individual families, I think would start to get more more useful. Connectivity that will, as we go through lockdown. You see where I'm coming from? It's just,
yes, absolutely. And each of those cases has a postcode attributed. So we do get to see if those cases are in the same household or across a general spread. I think Kelly might have something to add.
Thank you, Kelly.
Thank you, Kelly.
Thanks, Sabrina. Yeah, Councillor Barnard, we absolutely do have that level of detail. We hold a weekly IMT meeting where we do a deep dive into all elements of the data in terms of where there are clusters, where there are outbreaks, where cases might link together. We have the opportunity to include or exclude household clusters or outbreak clusters. So we get a really granular level of detail on a weekly basis that helps us to understand exactly what's happening with each of those individual cases. Obviously, we don't share that information in the public domain, but that very much informs our actions and our risk management.
That's really where I was getting for that, which was we can then use that intelligence and understanding to work out what we need to do in terms of our response. Yeah, no, thank you.
Absolutely.
Thank you, Chair. Thank you, Kelly.
Thank you. Thanks, Kelly. And thanks very much indeed, Sabrina. Thank you. And we move on now to the agenda item 5, which is communications and engagement update, both at a national and local level. And sorry, yes, I'd omitted to go back for the urgent item, which is going to be introduced by Tim Wheaton, our Chief Executive.
Thank you, Leader. And I think this fits just after the work on epidemiology, because that sets the context for it. And I just thought it'd be useful just summarise for the board the main elements of detail of the government's roadmap that the Prime Minister presented yesterday, and just to draw out 1 or 2 of the local implications for us in Bracknell Forest. So I think the first thing to say is that we now have more clarity than we've had, and it's very welcome that we've got a clear roadmap out and based upon 4 steps. The timing, not absolutely certain, based upon it, not earlier than, depending on the progress with the epidemiology, but 4 tests to be considered in the move to each stage, to each next subsequent stage, which is around the vaccine deployment programme continuing successfully, the hospitalisation and hospital capacity, infection rates not surging to risk that capacity, and that no new fundamental changes to the risk levels because of new variants of concern. So those are the 4 tests, and the government's assessment is that those 4 tests are all met positively at the moment, so they'll move to step 1 on the 8th of March. Now, for the 8th of March, the main difference is that schools and colleges will be open for students. And the basic plan is that it will be similar to the opening in September, but with a number of key differences. The first is, of course, there's testing in schools now. The second is and that's testing of all teachers, and teachers, both secondary and primary, I believe, will be able to test at home. That will mean that they will need to have a confirmatory PCN test if they get a positive result on that, if it's done at home. But all teachers will be tested, and I think that's twice a week. Another difference is that pupils will be in secondary schools will be tested as well. They'll need to have a negative test before they go back into school, and they'll need to have 3 negative tests in the first 3 weeks done in school. And I think that's to make sure that those tests are supervised and that the young people get the hang of doing it, after which they will be expected to test, but that can be done at home as well. No testing for primary age pupils. Another difference is that face masks will be worn in areas where the 2-metre social distancing can't be maintained, in secondary schools and in primary schools for visitors and teachers. And I think the one piece in the jigsaw that didn't quite get prominence yesterday in the news stories is that there is an expectation that parents and carers will also be tested as well. And we're still waiting for the fine detail on how that will happen. It might be part of the community testing program. It might be it might be tested delivered from the school. It might be test delivered from the local authority. But there's sufficient time for that detail to come through and for us to work on that. On the 29th of March, then we'll move to step 1B, and then that's when outdoor sports and leisure. So we're talking with everyone active who are supplier, who manage our sports and leisure services with us about the date, the precise date, but the 29th of March is the earliest that can open, and our expectation would be that it would be open pretty well, if not then as soon as practicable afterwards. So assuming that those 4 tests are met, then step 2 will start not earlier than the 12th of April. And that's when, although there'll be no household mixing indoors, that's when you can begin when the rule of 6 comes in, and you can have 2 households together outdoors. The significance, particularly for us, is that the indoor leisure, including gyms, so Bracknell Sports and Leisure Centre, can then open as well, and libraries and community centres can open. In terms of the borough, it's at that point that all retail can open, including personal care premises and outdoor hospitality. Step 3. No earlier than 5 weeks after the 12th of April, so the 17th of May. And then the big differences that will affect us is that indoor entertainment and attractions can open. And at the moment, that's where we think Coral Reef fits in the scheme of things, an organised indoor adult sport. The advice on working is right the way through steps 1 to 3. Is that people should still continue to work from home where they can. And then step 4 comes on no earlier than the 21st of June, when it's not all restrictions gone, but that gets us back to as close to normal as I think any of us could have imagined would be the case. So that's the local implications and the steps that we'll be going through and the impact on individual services. Happy to pick up any questions on that, or indeed to pass them on to the members of the team.
Thank you very much, Tim. Thank you. Are there any questions on that? No? Okay, fine. Then now we'll move on to the communications and engagement update. And that's, I think, introduced today by Elena.
Thank you, Chair. Just bear with me 2 seconds while I try and share my screen.
we've got it.
Fabulous. It's very brief this week, this time. So it's just really running you through the priorities for the next 3, 4, 5 weeks, probably beyond, actually, following on from the Chief Executive's presentation on the changes. It will probably take us up to the sort of June deadline. So the first priority really is around changes to national guidance and the impact on our local services and our local communities. So last week we had the changes to shielding, which we promoted, and we have worked through digital and traditional communications to get that out to the stakeholders that need that information. And then following the Prime Minister's roadmap announcement yesterday, we are now working through what communications we need to do over the next couple of milestone dates to make our residents aware of what's happening and when. One of the challenges I just want to draw the board's attention to is around the stay-at-home message, which will be in force until around the 29th of March, and then it will change to a stay local message. So while our residents will no doubt be happy to have this roadmap and this clarity and certainty, there is still, for comms, quite a challenge in making sure people understand that it's not a free-for-all, that actually the rules are still there and they must be adhered to. Otherwise, as the Chief Executive mentioned previously, there is a risk that the 4 steps might not be met and these deadlines might not actually happen. So that is a challenge for us over the next 4 months. Our second priority will be around testing. So this really is around getting more information about community testing out to those people who are eligible. We've been quite successful in getting that out quite widely across the borough, but the challenge now is to get that information to the occupations, to the people who are eligible for that directly, so that they're going for their regular tests. We're continuing to promote regular testing through PCR testing and self-isolation as well. And we've also started planning just in the past couple of weeks for any potential surge testing. We have packs from the DHSC, which is helping us to plan that. But we've also had some really helpful advice from colleagues in Surrey who've actually been through it. So we're just looking to localise that just in case we need it. And then the third step is really about vaccinations and encouraging that take up, certainly around myth busting in partnership with CCG and health colleagues. And we're working with our engagement team really closely as well, just to address any gaps with our harder to reach audiences and how we close that feedback loop and get them the right information in the right format. We are continuing to use a range of digital and traditional channels to reinforce the safety messages and restrictions. As you can see on the left-hand side of the screen, we're using real people from the borough. We're finding that human case studies is actually better. It's what our residents resonate with. And certainly research from local government colleagues and research groups who work in local government have, it's definitely shown that the national assets are becoming very much like wallpaper. So we will continue to look for local people and use local voices as we go through the next 4 months. That's really it in a nutshell. So happy to take any questions.
Thanks very much indeed, Elena. Thank you. Colleagues, are there any questions? No? Okay, can't see any. So thank you very much indeed, Elena, for that. And that brings us then to item 6, which is public participation, to receive any questions from members of the public. And I don't believe we have any fresh questions for today, but just for the record, we do have a couple of supplementary questions from a questioner from our last one, which are directed at the NHS. So Fiona Slevin-Brown from the NHS is going to take those away and answer them directly. So thank you very much indeed, Fiona. And we have an item 7, which is terms of reference. We need to agree the updated terms of reference, which contain a change to the membership of the board for the Thames Valley Police and for Involve. Kirstine, do we have the details?
Yes, Chair, thank you. The changes to the terms of reference are for the Thames Valley Police to include Acting Inspector Sophie Gardner as the representative, and to now include Philip Bell from Involve as the voluntary service representative. Those are the only changes.
Thank you very much indeed, and a belated welcome to Philip. Good to have you with us. Welcome. And we look forward to meeting our new police representative next time. Then are we all agreed on that change? Does anybody not agree? We'll do it by assent. No, I see no dissent, so therefore by assent we have agreed those terms of reference. To review by exception the local outbreak board action log, is there anything to be looked at there? I don't see anything coming up. Fine, in which case, thank you very much indeed. Our next meeting is due to be on the 16th of March, outbreaks permitting. And I look forward to seeing you all then, and thank you very much indeed for your attendance today. So thanks very much indeed, everybody.